I think what motivates me every day, and really for our entire workforce, is it's our customers. When they need their health coverage, it's typically when they're at their most vulnerable. So we've got a huge responsibility to meet their needs and to serve them in the way that they need to. And it's not just for today, but it's for tomorrow as well. I think the reason that it's so personal to me is being an Arkansan. I was born there, I was raised there, my family's there. Is that our customers are our friends and family members, and I want people to be proud that they do business with us. I think what needs to be improved with the consumer experience is today, unfortunately, it's just too complicated. We've got to talk to people much more simply. We've got to provide them with information and with tools so they can become much better informed consumers than they are today. And so we're spending a lot of time, a lot of resources within our company to make it more simple. We've got to serve our members in the way that they need to be served. For our seniors, for example, we have 7 retail stores located throughout the state of Arkansas, and that gives them an opportunity to go and deal with somebody face-to-face and have their questions answered really by an individual. On the other end, we're developing new technologies all the time so that we can communicate with the much more technology-savvy millennials in a way that they're very comfortable with as well. By far, the number one thing that I hear from our customers is they need sustained affordability. The first thing that we've done is really to build a strong primary care system within Arkansas. Because it is a rural state, there's a lack of healthcare providers and community resources and home-based resources, so it makes it a real challenge. We've worked with our academic medical school to fund scholarships and to emphasize primary care in our state. The importance of primary care is to provide really a place for good quality, comprehensive, lower cost care versus in a specialist office or somebody going to the emergency room or to a hospital. The other thing that it does, it puts that primary care physician in a position to be a care coordinator for the patient. To provide a much more affordable healthcare system, you've got to get at the underlying issues that drive healthcare costs. You've got to improve the health of the members and communities that we serve. I think what I'm most excited about the future of healthcare is that we're in a position to build a better system. And when you think about the conversations that we're having today with providers and with our customers and public officials and others, I think we've all come to a common realization that there's just a limited amount of money that can continue to go into the system. And so we've got to work together much better than we ever have before to build a better healthcare system, to use those funds and those resources much more wisely than we ever have before.